that question maybe to someone specifically, but if you think you want to add something on, then please feel free to do so. This will be the opportunity for you to sum up towards the end, and even if you forget something, to say something this morning, and you realise afterward you can write it to us, we're still happy to take evidence. So I'll kick off the proceeding this morning, and I think it's probably right that we should get the Mayor's office to comment first on this issue before we start looking into how we can add value to So, Amanda, the Mayor has decided to launch the Healthy Early Years initiative. Why did the Mayor decide to do this in the first place?
So you'll be aware, Ankar, that the Mayor is consulting on his health inequality strategy at the moment. And one of the 5 priorities is around children and actually ensuring the best start of life for all our children in terms of health. And it's within the context of that the Healthy Early Years discussions has occurred here in this office. And of course we're building out from a very successful Healthy Schools programme, and as a consequence of that, and the evaluation pointed to that as well, that we should actually look at extending this type of programme to early years settings. So we have been doing quite a substantial body of work to gather the evidence to be able to define what a programme would look like. And we've also done a small pilot to be able to test what an early years scheme would look like too, with a view to being able to actually roll out a programme in 2018.
Right. I know that the previous Mayor also had a programme. Will this be different from the previous one, or will this be building up on what the previous Mayor had done?
Well, I think a lot of the analysis that we've been doing in terms of actually defining this programme is actually looking at where there's the greatest need across London, looking specifically at those boroughs where there's more deprivation, so that we can actually target the programme to be able to meet those children who need that support to be school ready, both in terms of the educational outcomes, but also in terms of social emotional resilience and the wider health outcomes, with the view to actually reducing health inequalities over time.
And what are the key health and well-being issues that this programme wishes to address?
Well, I know that you've put out a press release, and clearly we were really encouraged to actually see that in that you're picking up the similar issues that we're looking to address. You'll have seen yesterday that the Mayor announced actions within the London plan to tackle childhood obesity in terms of exclusion of fast food restaurants around schools. So clearly it's actually pointing to the fact that we do have an obesity issue with our children. So it'll look to address that. It'll also look to ensure that we actually pick up and address health in its fullness in terms of a whole system approach. So looking at physical activity to increase that. Looking at addressing the 1 in 3 5-year-olds in London who have tooth decay. Also looking at how we support children with long-standing illness and disability. That plus some of the wider health issues in relation to immunisation rates and also social emotional resilience. So this is very much a whole system approach to be able to actually work with children within early year settings.
I mean, London does worse than the rest of the country in some areas for children. For example, we have a greater number of low birth weights. We have a great number of obesity in children. When they go to primary schools. I know that 1 in 3 5-year-olds have tooth decay in London. So we do have a bigger proportion of problems to solve. But do you know the reason why London does worse than the rest of the country?
Do we know? I think it's complex. I think children growing up in an urban environment face different challenges. We know with issues relating to physical activity. We know proximity to green spaces and so forth actually promotes that. So I don't think you can say it's a single issue, which is why the programme that we're looking to design takes a whole system approach to be able to actually look at a range of aspects which actually influence children's health, with a view to actually being able to actually intervene earlier. And also to intervene across the community, so it's not just the children, but it's also it's providing education to early years educators. It's also working with parents, and it's also working with community groups to be able to actually make a whole system change to promoting wellness across early years, and hopefully seeing that translate into school age behaviour and then onwards into adulthood.
There are many issues facing these early years, but are there any particular areas that you want to prioritise, which are priority for the mayor and for the healthcare team here?
I think when it comes to early years and to children, I don't see us actually prioritising any one particular area over another. I think what will be really important is actually making sure that our programme actually touches all of those people who have an influence over children, and I think that will be a very key focus in this programme.
Good. Thank you. Well,
yes. You mentioned the banning of the takeaways near schools. Can you explain to me why that would be a good idea when there are newsagents selling chocolate, there are garage forecourts selling crisps and chocolate, and so on and so forth? Why in particular has that been highlighted by the mayor? Because it seems somewhat ridiculous to me.
Well, tackling obesity, without a doubt, there is no one silver bullet. We know that obesity is very much correlated with deprivation. And we know that we need to be able to take a whole system approach to that, and as you rightly have pointed out, things like the offer within convenience stores is particularly important, especially in deprived neighbourhoods. But the reason I made reference to the announcement yesterday was because it's in the context of actually how we plan our cities, and actually having an exclusion zone around schools actually limits the accessibility of high calorific foods to children, and it's just an example of one of the things that we're looking to do. Part of the health and equality strategy talks about healthy habits, and within that we do talk specifically about obesity, and the mayor's ambition to actually set up an obesity task force to be able to look at obesity in its widest sense. Yes. And that will pick up those key areas.
I totally get the obesity thing. There's no question about that, of course. And you say there's no silver bullet, but it looks like a bit of a scattergun here, bits there. It's no good getting rid of a fast food restaurant when there's, as I say, newsagents, garage forecourts everywhere that's just selling loads of sugary drinks, chocolate. So you're picking one little thing out, which won't make a blind bit of difference because there's all the other things there. So I'm just concerned that if you do things like that, A, it's just the nanny state gone mad again, but B, it's not going to stop. What do you want it to stop? Because there's existing shops there anyway. I mention this because you have, and the mayor has highlighted it, and I think it's particularly ridiculous because it won't stop people going to fast takeaways because there are others around, and there's other food that we would all accept is not good for children in all sorts of other venues. So it's interesting to hear your response, so I'll leave it at that. Thank you.
What's really key about that is actually, and particularly about the programmes that we're looking at developing, is about actually education, and it's education of parents and communities and childcare.
I accept that as well.
Workers. But so you're absolutely right in terms of saying actually we need a very holistic approach to be able to tackle obesity and other other programmes within the Mayor's suite of health programmes actually look to address some of the things you've just rightly mentioned.
We need to do things that are going to be effective.
Absolutely, and evidence-based.
As we know, this is a very complex area, and I think that the announcement yesterday was in the context of the planning of London Plan, I think, rather than the strategy on obesity. But just turn to other members of the panel. Has the Mayor got it right, the setting the priorities? Should there be other things that the Mayor should be looking at, or have we got it right? Maybe Melanie?
Well, we know that the sooner we start with early intervention, the better. And quite often things have been left until children are at school age before there's any intervention. And certainly as far as Preschool Learning Alliance is concerned, we know that the biggest difference is made in the first 1,000 days of a child's life. So it's something that we absolutely welcome. And part of this, and it was interesting when you said about the fast food outlets, and I do agree with you that, you know, about this sort of scattergun approach, but it's also a part of how we establish healthy lifestyles, as you mentioned. And family meal times are very important in establishing those good habits for life. And fast food takeaways, you know, where that's your main meal of the day perhaps, doesn't encourage that family mealtime attitude where we learn about healthy lifestyles. So I do welcome that initiative and look forward to helping, hopefully, to shape the early years programme, because I assume there's still work to do in shaping this programme. So looking at what's already out there, what good practice already exists, and how we can tap into that and work together.
Laura?
Yeah, so again, I think showing leadership and through good quality childcare is a really great way to shape the agenda around good nutrition and physical activity. And those priorities are really welcome. We would suggest that supporting parents would probably have the most impact and should be the highest priority as early as possible. And so sort of linking up with pre and postnatal community support even before children are accessing childcare. In terms of what's missing, I thought one of the aspects, if you're looking at sort of social resilience and emotional well-being, could be a focus on speech and language development for a lot of young children, but also the targeting towards children on the lowest incomes. You know, we wouldn't deny the value of this programme at all, but there's quite a big gap that concerns us, which is a recognition that childcare in itself is a system that has unequal access for the very poorest children in London, and therefore it's a difficult ground to tackle inequality within. You know, as a network, for entail, we argue for access to high quality, affordable childcare, but that hasn't been achieved for lots of very poor families in London, and so by focusing on childcare settings we could actually miss some of our most marginalised families. And the programme is based on a model that worked in schools, and we have to recognise that almost all children are in school, but not almost all children are in childcare. So even when the most disadvantaged children are in childcare, they don't all eat at childcare. So then you get the sort of, even if they are accessing the childcare, they're not there at the meal times in order to share that experience and get the nutritional learning there. You know, you don't get a free meal with your free childcare, so some opportunities to encourage healthy eating will be lost through that. So I wonder if that's something that the Healthy Early Years programme could look at, a way of encouraging local authorities to use some of the funding that's available for more disadvantaged children to pay for meals within the setting, so that it is a genuinely free offer.
Can I just on that, it's interesting what you're raising about the issue about focusing on those that need that help most of all. Is there a problem with the whole comprehensive model of childcare provision? Because, you know, anecdotally we've all heard stories about Sure Start centres being filled with yummy mummies who possibly don't need that kind of support, and perhaps are muscling in where others should be the focus of our early years intervention. is there a problem with this idea that we just make the service available to everyone?
No, I think there's really strong arguments for making parenting support as universally accessible as possible, and to have strong leadership from the Mayor and the Assembly on sort of putting out really strong parenting messages, so that everybody feels that it's something that they can take part in, and that there's not a stigma attached to it.
Okay.
And actually Sure Start itself, the evidence has shown, if you're looking sort of for evidence-based practice, that Sure Start centres can actually have a really strong impact on parenting behaviour at home, which is obviously what this is trying to achieve, is to improve.
I absolutely agree. I think
Yeah.
Sure Start centres
Yeah.
are great. It's something I changed my opinion on, actually, on Sure Start.
Yeah.
Originally I thought they were a wrong kind of intervention too early, but actually I've completely changed my mind because they really work. But I am worried that those kind of services aren't being made available to the people who most need it because of the pressure of providing to people who possibly don't need as much support as they do. And that's my only concern about the model.
And I think that's a really interesting discussion for the GLA to have with local authorities about where they invest in maintaining their children's centres. Because like you say, obviously local authorities are under a lot of pressure and children's centres are having to close. And where do they close them? Do they possibly close them where there won't be a big fight? Or do they,
Yes.
you know, so there is a question there about that we can have with local authorities, and so I think children's centres are built into this, aren't they? And I think that relationship with between childcare providers and children's centres, and encouraging them to work together for the community, would be really important.
Thank you very much. Thank you, Ziki.
Thank you. David?
Yeah, I was just going to say I sort of welcome the idea of the Healthy Early Years programme. Speaking from experience of, I've coordinated the Healthy Schools programme in Westminster, Kensington and Chelsea and Hammersmith and Fulham for 4.5 years, but 2 years ago we developed a Healthy Early Years programme that was very much based upon that, which I should imagine to be very similar to what you're about to launch here. And I've seen that make the difference. And I would say the other thing is, you've got capacity, so the way we work is we target those wards with the most socially deprived, and that's they're the children's centres and the nurseries and the PBIs that we work with in the first place to actually get them up to the standards of bronze, silver and gold. And then the second area would be possibly those schools with the highest National Child Measurement Programme figures on obesity, and that quite often they'll have a nursery attached or nearby, and again they'll be the second level settings that we'll work with. So you can target where you deliver this as well.
Thank you for that, David. Did you want to come in, Nicky, Christine?
No, I mean, the only thing I would say is that it's about the overall development of the child as well. So I know in our nurseries we have a plan of our meals are balanced and they're spread out throughout the day, but again it's looking at different childcare settings, like we talked about childminders, where actually parents provide the meals for the children in those settings. So again, it's about the education for them at that stage as well, and education I think generally for the parents would be, you know, is a good key focus.
Thank you. And we're going to, of course, explore this out a bit more deeply as we go through the morning. So I'm going to ask my colleague Susan to take over.
Thank you. This is actually to all of you. In your view, which of the proposed issues to be covered by the programme are the easiest for the early years providers to tackle, and which would be more difficult?
Okay, well certainly all registered early years practitioners have a remit to engage and work with parents to support children's health, learning and development. So in terms of support for practitioners, I think that's one of the easiest things that we can achieve, is upskilling practitioners in order that they can have those conversations with parents and be seen as that, as they often are, that safe source of support where they feel they're not being judged, where they can ask their early years practitioner things that maybe they wouldn't ask their health visitor or another professional, because they would feel they maybe be judged as, you know, as bad parents. So we do build upon that, knowing that practitioners are that safe source of support, and I feel that anything that we can do to upskill them in order that they can provide good advice, signposting and role modelling as well for parents, I think does make a big difference, and it's part of the early years remit anyway.
And what do you think is going to be the most difficult?
I think it's about getting parents to make the changes that are needed, because yes, we can provide the advice, we can signpost parents, but there are so many factors that influence you when you actually go home and want to implement those things. You know, marketing of the way fast food and bad foods are marketed at parents, at children. You can have all the good intentions, you can have the information in front of you, but actually going home and making those changes is often the challenge.
Thank you.
Okay.
Anybody else?
I think the most difficult areas is just going to vary from borough to borough, because it depends, it's not the setting, it depends what support you've got. So if you want to focus on oral health and you haven't got an oral health team in that local, or it's not being invested in, if you haven't got a dietetics team in another area, or you haven't got someone else who's providing the specialist physical activity or literacy support, they're going to be the areas that are going to be more difficult for those settings. But that would just vary from borough to borough. I think if the support's there, the setting don't find a problem with any of those things. It's just whether the support's there in the first place.
Okay. And what do you think's easiest?
Easiest in terms of?
But part of the proposal of the programme, I mean, what do you find the easiest? And
I'm not quite sure if there is an easy. I think it should always be a stretch. I think every area should be a stretch because you're asking them to improve in different areas. For me, if I'm going in, healthy eating can be an issue if they haven't got the... Going back to it again, I'm going to be repeating myself. If they haven't got that support, if you haven't got the dietetics, so any of the areas can be easy if you've got the support. If you haven't got the support, then they're the difficult.
Okay, I get that.
I think some of it as well is going to be the provision that the childcare setting is in and what the so the resources that they have as well, so whether they have got kitchens, cookers and those sorts of things, and access to the local shops or a supplier where they can get healthier food. I think that's going to be
and also the space that they have in the childcare setting, because different childcare settings have, you know, different premises and they have different space available to play. And one of the things that we've asked for before in our Invest in Childcare report is, you know, whether more can be done to get funding for childcare in poorer settings, in more disadvantaged communities, to improve the play equipment that there is, so that even in a smaller garden or outdoor space they still have quality climbing or, you know, physical activity that they can take part in.
And access to schemes such as forest schools, which, although that might sound very leafy, sort of rural, actually there are some very successful forest schools programmes, even in this area, that are operating, that make a huge difference to children that don't have access to outdoors, and obviously through that boosting their physical development. So, yeah.
Okay. Fine, okay.
Can we just ask on the equipment? I'm surprised that there is a problem, because usually we hear about problems of revenue expenditure, of staffing and all the rest of it. But you're saying there's actual problems accessing new equipment and fresh equipment for some childcare settings.
Yeah, depending on the childcare setting. And I think that's the thing. This is such a broad market that we're trying to address. You know, there's a huge difference between nursery chains and single-site childminders, and the opportunities that they can offer for the children in those settings.
Pack-away settings is another example.
Yeah.
You know, in church halls, huge issues for them, especially around resources and equipment. Yeah.
Do you think the smaller businesses are really pushed at the moment with costs of rent and?
Oh, absolutely,
Enormously,
absolutely. Gosh, they're on their knees.
Yeah.
I was going to say, sorry.
No, carry on. Please.
I was going to say with the physical activity as well, though, it's not all about having large bits of equipment. It's having maybe smaller bits of equipment and learning to use them in different ways. So you're developing different motor skills, and that's part of the support that someone like ourselves would provide to a setting. You do training to use equipment, and in different ways each day. So then you're stimulating interest in those activities. You're not just putting the same thing out every day as well. So it doesn't always have to be a big equipment. It's just creative thinking and approaches.
Thank you.
Okay.
Amanda, what will providers be expected to demonstrate in order to receive and maintain accredited status at each level?
So, as I mentioned before, we're in pilot and development stage at the moment. So we are looking at a 4-stage criteria for the programme, and that's starting with kind of first steps in terms of actually quite a straightforward registration process in terms of actually interest in the programme actually and access to resources. And then 3 different stages: bronze, gold and silver. Through our piloting exercise, we are determining what will be the criteria for each of those levels. But suffice it to say that actually we'll be building out from the government's the Department of Food and Education drink guidelines. We'll be looking at all the evidence in and around physical activities. We'll be building out from public health guidelines to do with immunisation and keeping children healthy. Also looking at the mental health issues associated with both parents and children, to ensure that we actually give nursery and childcare settings a range of different options that they can look at to be able to tailor their assessment around the children that they're looking to provide care for. So, for example, with settings which have children with learning difficulties or disability, there would be quite a comprehensive range of activities they could look to be able to explore within their policies and their practice to be able to seek an accreditation at one of those 4 levels.
I mean, given that it's so broad, is there a great deal of paperwork that comes with all of this?
Well, this is kind of the challenge in terms of actually. So we want the scheme to be as least onerous as possible. However, what we're trying to demonstrate is impact from this programme. So we actually want practitioners and childcare settings to actually, implement the type of actions we want to see accredited across those 4 levels. So there's a balance between actually stimulating nursery and childcare providers to be able to actually stretch themselves to improve the outcomes for their children, whilst also actually, overall raising the standard of health amongst those children within those settings. So there will be paperwork involved in that, and especially towards the higher end of accreditation, because we do need to see evidence that these childcare providers and childcare settings actually are doing this day in, day out, rather than doing a tick box exercise.
Do you think this will disadvantage the smaller businesses? Because Melanie has just said that they're on their knees, and anybody that runs a business, it's difficult. And I know that getting staff, or I have been told that getting staff is quite difficult. Given that this is clearly another burden on them, and you could see it as a burden, what is the incentive for the smaller businesses, or the providers, I should call you, sorry. What is the incentive for the smaller providers when they're stretched with all the new schemes that are coming out on all sorts of different levels? What's the incentive to do this?
So clearly it is a voluntary scheme. We do recognise that the scheme needs to be developed in a way that actually encourages businesses to be able to look at how they promote health across the children they're responsible for, and we think it's in the context of that actually that businesses should be able to see what we're suggesting as integral to good child development, to providing the outcomes they would want for the children within their care. the other thing we recognise is that it will be an accreditation scheme, so they will be awarded with a certificate, which we think should provide an incentive to businesses, because it's something they can market to their parents and to their clients. But really underneath it all, it is about the impact on the child and the impact on the parents and that wider community in terms of actually promoting health-related behaviours from the earliest start.
I mean, Mindy, you were talking a bit earlier on about that you did run some pilots, right? But what were you testing in those pilots?
So what we were trying to test within those pilots, first off, is we have a clear model, we have a clear theory of change in terms of what are the key things we need to actually see within nursery and childcare providers to be able to actually improve the health of children. So underlying all our program is the impact on healthy early years health. So what we're looking at was healthy early years engagement in terms of actually how do we work with businesses so we can co-produce it with businesses so that it's attractive for them. We were looking at the wider benefits in terms of to communities and to local authorities and how we work within those settings and with boroughs. We were looking to see what support would be needed for the settings in terms of actually making the paperwork easy to do and actually reflective of the effort we were looking for from these providers. We were also looking at the effectiveness and the user friendliness criteria of the program, and also looking at the effectiveness of the pathways we would provide to the providers in the early years settings, and the support that would be required for them to be able to actually embed those really good health promoting behaviours within both the setting itself for the children and also for the wider parents and the community.
And there is evidence to suggest that those things you're testing out have impact on outcomes.
Yeah, so as I mentioned earlier, we built out the scheme from our existing successful scheme, the Healthy Schools programme. The scheme is absolutely and utterly evidenced on what we do know makes a difference in terms of child health, and we're very lucky in this country in that we have a whole body of evidence and some great support from our stakeholder network to be able to inform and actually provide some of the evidence upon which to base this programme on.
Thank you, sir.
You mentioned the Healthy Schools. What's been learned from the Healthy Schools programme that's helped to shape this Healthy Early Years programme, and are there any significant differences in approaches between the two programmes?
So clearly, we did an evaluation of the Healthy Early Years, the Healthy Schools programme in 2016. I'm just looking for my notes to give you some ideas on that. We used that evaluation to actually inform what the type of things that we wanted to see within the Healthy Early Years programme. And we were very clear that we wanted to make sure that the programme was evidence-based, and that we actually tailored our theory of change for this particular programme around earlier interventions for this group. So clearly key areas like breastfeeding, also areas in terms of actually physical activity designed for younger age children as distinct from school age children, and they were the type of things that we were looking to actually make the adjustment in our early years programme. The other fundamental difference with this programme is we have a finite number of schools, and as Laura said, the majority of our children actually attend schools. So what we needed to do is actually make adjustments to this programme to be able to access a much larger number of providers, and also with a huge variation of facilities and in terms of providers as well. So they were the type of things that we needed to think through in terms of designing the pilot, and then ultimately to take through to the actual programme itself when we launch next year.
And when you're going to launch it next year?
We are just working with this current administration to be able to actually agree a launch date for that. We're also talking with the wider local authorities about how they're going to support this particular programme. So we'll probably hope spring.
Do we have a rough idea?
Spring.
Spring.
Okay. So if I could come back on the Healthy Schools programme. So one of the things I saw in the evaluation of it was how key the links between the GLA team and the borough teams were in making sure that the programme targeted those most economically disadvantaged areas. And I wonder if the same kind of relationships are going to be possible with local authorities when we know that there are at least 7 local authorities who still haven't produced a sufficiency audit for the childcare in their own communities. When that's a legal requirement for them to do it, they're still not making sure that there is sufficient childcare in their area. And if they're not engaged enough to do that, how engaged are they going to be in order to work with the GLA to push a programme that will improve the health of the children in those childcare settings?
Well, that's a much better question than any of mine. So, Amanda, how would you
Sorry.
That's a good woman. Come and sit next to you.
So that is a very valid analysis in terms of the key challenge of engaging the local authorities in this particular programme. We know that there's 14 of the local authorities have healthy early years schemes. So over 40% of the boroughs already have an investment. It's going to be really, really key that we link up our work here to what Joanne McCartney and the education and early years team are doing in terms of the childcare hubs. So we have a childcare hubs programme.
Do you think we should have a charter for the local authorities?
It is a statutory requirement that they do this, so
we can really do a bit of marketing there and give a charter to local authorities who aren't playing ball.
Yeah, absolutely. I mean, we really welcome the Assembly's scrutiny, in the area of childcare, to be able to actually, get some of the local authorities to do what they statutorily are obliged to do. We think that the implementation of the childcare hubs, of which we're planning 3 across London, will act as a magnet to be able to provide some of that support back to some of the boroughs where we think they're not providing adequate support for childcare within their particular boroughs. And one of the ambitions for those childcare hubs is also to actually provide that sort of outreach to provide support to both parents and providers to be able to reach those who actually don't currently access the free 2-year-old offer, and also providing the challenge to the government on that in terms of for funding for that offer, especially for those who are most deprived.
I mean, right at the beginning, you said that extensive work had been done to see what the programme would look like. Laura brought up such a good point there. I mean, where are you with dealing with the authorities that are not doing what they should do?
So what we did in our pilot was actually we put a call out to those local authorities who actually wanted to work with us on those pilots. And our starting point was to work with the willing, to be able to develop something that we could co-produce with the local authorities, so that we know that it works with local authorities and actually supports what provision those local authorities have in place. We will have a job on our hands to be able to actually seek that sort of universal engagement across the local authorities, and I think we'll have to think creatively about how do we service those boroughs where those boroughs are choosing not to invest in early years, and we will actually have to do some direct engagement with nurseries in those boroughs.
But if there are sufficient numbers of boroughs that are not going to play ball, where does this leave this scheme?
So we're basing our experience on Healthy Schools London. We had a similar situation with Healthy Schools London, and actually by providing the resources and a network for local authorities to be able to come together, what we saw was that that a lot of the local authorities who had disinvested in healthy schools reinvested in healthy schools. So our programme is designed in terms of to be able to stimulate that interest, to be able to actually share the evidence to local authorities that actually investment in early years gives you a very clear return on investment, and also to have those difficult conversations with the local authorities about investments for children who come to most deprived neighbourhoods.
Okay, and you haven't had that conversation yet?
We have had some of those conversations. I mean, I don't want to mislead you to say we've had blanket conversations with every local authorities.
Okay. David was been...
I was just going to say, launching any of these programmes is not easy. It's never going to be successful straight away. Healthy Schools, when that was launched as a London-wide programme, there was only 12 boroughs that had a local programme. With Healthy Early Years, you've got 14 boroughs with the Healthy Early Years programme. And now you've built it up to 25, 26, I can't remember what it is now, maybe even 28 for Healthy Schools. I think you could do the same with early years. It has to make a start, it has to be seen to be working, and then you gather that momentum. And you do that by a sharing network. So you would, the same with Healthy Schools, you bring different boroughs together, you have meetings here with those people who have got some responsibility for promoting health and well-being in those settings across the boroughs. And it might not be a Healthy Early Years coordinator, it might be a Healthy Early Years advisor, but you get them here. Once they start to see the difference and they learn from that from the other boroughs, then that's how you then start to make that change and get the other boroughs to come aboard.
Yeah, I would definitely say that, you know, having a sort of city-wide scale initiative would give something like this impetus, you know, and having good, recognisable, pan-London, identifiable set of messages about good parenting and, you know, what parenting support is available and what is healthy eating. They're all really good things. Like, we shouldn't say that this, you know, this isn't, it is definitely a good step forward in improving child health. You know, the reservation that I have for the network is it about improving child health for children who are already in settings that would be relatively healthy already? How is it tackling the inequality angle of it and improving the health of the very poorest?
I think we're coming on to that at a different... We've gone through quite a bit of this, so I'll just ask all of you, but only if you've got something specific that hasn't been brought up. How would the proposed programme differ from your perspective from what already exists, either at a borough level or at a national level? Is there anything different to add?
I don't think there is, actually, and I think one of the key things that's really important for me is that we look at ways in which we can tap into some of the existing things that are out there. So, for example, the Alliance was one of the co-founders of the Early Years Nutrition Partnership, which is an independent social enterprise that looks to achieve most of the things that this scheme wishes to achieve. So it would be good to think that we could work in partnership together to say, well, if you've already achieved such and such, it helps you to meet, you know, the criteria for the bronze or for the silver or for the gold. And I think that's really important because, like I said, there's a lot of really good things happening out there. So let's look at ways we can tap into those as well.
Anything else? No?
Yeah, sorry, just one of our members in the network also spoke about that and about the chef's training.
Yes.
You know, which feels like, you know, a really good initiative that people are already doing, which is about making sure that chefs who provide the food in childcare settings are trained sufficiently to know about what's healthy options, and that you could see easily if they had that qualification.
Absolutely. We also work with the Infant and Toddler Forum, who provide information for practitioners and parents. So for us, again, that's a way that we actually, you know, bridge the gap between what's happening in the setting and what's happening at home. So there's some really, really excellent things out there. So let's make use of them as well.
Yeah. There are also some very good charities out there already looking at this, and we already have accreditation with a charity called Food for the Brain, and they are looking at, you know, early development and suitable food, and then going on through to later on in life, and also looking at dementia and the whole process that actually need to start at a very, very early age. So there are resources out there already for people to tap into.
Sorry, what was the name of that
Food
charity?
for the Brain.
Food for the Brain. Okay, thank you. Right, and so the last one on this particular, what are the benefits, I mean, you touched on it, Melanie, what are the benefits of Pan-London programme on this issue? Are there any drawbacks to a Pan-London approach?
Well, I've actually made some notes on that one. I think I think it's higher profile. I think it's shared practice. You'd be bringing people working together across different boroughs, the same as at the local level. We have settings actually sharing practice with each other. There's a focus across London, networking, higher profile, linking with strategic partners, and I think that's key as well. And you need to do that at borough level, but you also need to do that at Pan-London. I think the challenges might be the fact of sign up of those local authorities have already got their own Healthy Early Years programme. Does it align? Is there going to be an issue with that? Because they might have invested in it already. I'm not saying they won't, because that's already happened with Healthy Schools, but that, you just have to recognise that can take a little bit of time for that to come in. The assessment of the awards, that has to happen at a local level, and again you need to have people who are able to do that within the local authority, so it's setting that up, training for them for that. The cost for local authority, that could be a barrier for some, not for all. And I think capacity is another issue. Even with Healthy Schools, you've got so many different Healthy Schools programmes. The Healthy Schools programmes I coordinate, I'm really lucky because I can focus just on that Healthy Schools programme. In some others, it might be someone with a substantive post, and they might be within public health or education, and that might be one of 6 roles they have. So they might not be able to put as much focus on the programme per week as another borough. Yeah, I think they're mostly the challenges.
The real benefit, I think, in this type of programme is that actually we can actually work once with some of the key stakeholders who bring with them a wealth of both evidence and assets to be able to actually galvanise those into one place, and then for us to be able to take a leadership role to be able to share that across the 33 local authorities. And actually doing it just once for London allows us then to hopefully try and reduce the variation that we see across nursery and childcare providers, so that we can actually facilitate that education of early year educators to be able to actually put in that bedrock of health within our children.
Good, thank you. And we're going to come over to support for parents now, you Manish.
Thank you, Chair. Regarding support for parents, Amanda, if I could ask you first to put some flesh on the Mayor's vision of the supporting parents element of the programme.
So we recognise that that children who attend early year settings and childminders actually are only there for sort of you know probably 40 hours a week. So a lot of what needs to be done in terms of actually improving the health of children needs to be done within the home. We absolutely welcome the opportunity to work with organisations like Melanie and actually recognise that a lot of the tenets of good health actually are built up within the family settings. So actually making our programme extend its reach into parents and communities is really, really important. Our programmes also sit alongside some of the other the mayoral interventions to do with social integration. So we know within those programmes that we'll start to see parents being targeted in terms of actually making sure that health and welfare are communicated to parents. key within the programme is in and around education, and we've seen through our Healthy Schools programme that actually children play a very vital role in terms of educating their parents as well. So we will be looking at the programme as it rolls out. We'll be doing an in-programme evaluation to see year on year what sort of impact our programmes are having, and also to see what sort of amendments we need to make to our programmes to make sure they are as impactful as they possibly can.
Right. But I mean, could you give some more practical examples? You talked sort of in general terms, but I mean, how do you, the concept supporting parents, and you talked about social integration and health and welfare, but how do you share one's agenda? Could you give one or two examples?
Well, what we see from parents' interaction within healthcare environments is they are very interested in the food that's been provided to their children. They're very interested in the activity levels of the education provision within childcare settings, and it's within those conversations that information can be passed across between the childcare provider and parents. What's absolutely key is the education and support we actually give to nurseries and childcare workers, so that they have the ability to be able to communicate that to parents. And if we get that bit right, and if we get the resources that we give childcare settings and nurseries, then we will quite naturally improve the amount of education that is transferred between the settings and the parents. I'm sure some of the other panel members have probably lots to be able to say in terms of the evidence too.
I'd certainly like to add to that. I mean, every day in early years settings there are conversations happening between parents and practitioners, and every day practitioners are saying things to parents that make a small difference that we can't even begin to measure, and those build up. And I think that's a really important thing to remember, you know, that the relationship that early years practitioners build with parents is key to that child's overall health and development, learning and development, and it's something that we are in early years very good at doing already, so we can build on that.
All three of the levels of bronze, silver and gold involve parents and provide both participation and support. At the bronze level, at that basic level, you'll be doing stuff around promoting breastfeeding, weaning, immunisations, oral health, being registered and going regularly to a dentist every year. So there'll be all those things plus signposting to local services, and that might even be it's almost like Citizens Advice Bureau sometimes. That it's housing, access to health, access to all these different areas, and then at the silver and gold level, you're normally working with the parents because you was asking about the process. You're looking to make change, so you're looking to see maybe how often the child cleans their teeth per day. Are they using the right techniques? So there's training with the parents there, and then it's surveying them, getting them to ensure that they're doing that afterwards. It's the amount of physical activity they're getting each day. And then on top of that, from the providers themselves, when we've done a local survey on our recent event on what support and training they wanted, the two areas were both about engagement with parents, one on how to raise issues or identify issues around mental health, and the other one was to raise issues around domestic violence. So all of that is participation with parents.
Actually, in fact, you started answering my second question. So obviously you see providers as supporting parents, supporting parents is a key part of your role. And if I could ask you to come in as well,
Nicky.
Yeah.
Yes, so one of the things that with the parents we do is have, we demonstrate how much food the children actually have. So particularly at the moment we have a lot of parents who come in and say they don't want their children to have any sweet puddings. Sugar is obviously a really big key thing at the moment, so we explain all our food is made in our settings, it's made on our sites. We're not providing the children with a cookie like you get in a national coffee shop chain that's this sort of size. You know, we're talking about a sweet pudding being this sort of size. So you know, it's those sort of things, having cooking. I know a lot of the children's centres do cooking activities with the parents, and we'll do things to take stuff home and all those sorts of bits. But I think one of the key things is getting the parents to, you know, again, it comes back to practitioners talking from a very early stage about when their children stop eating, when they're weaning, and the parents kind of start just giving the children any food, so that their child will eat, and actually educating them to say actually the healthier food is still the better option, and sometimes not always pre-made jars and things like that, you know, actually natural food and things like that. So yeah.
Thank you. And if I could ask all of you a bit, what more can the mayor do?
I think Laura wanted to.
Oh, sorry.
Sorry, I was only going to say that.
I do apologise.
No, you know, we know that the take-up of the 2-year offer for the most disadvantaged is only at 60%. So there are 40% of most disadvantaged 2-year-olds who aren't accessing childcare, and that's within the crucial first 1,000 days where the parents are learning about what are the healthy habits to feed their children. And so, yes, obviously a lot of childcare settings do support parents. There's a huge variation in how they see their role doing that, obviously, but there is still that problem of those who are not accessing until really quite late in the early years time, and habits will already have formed within the family around what is healthy eating and the impact. So, you know, if you're looking to tackle childhood obesity, for example, you know, we know that there are Black British children in London are accessing less good quality childcare than white British, so that will have an impact on the healthy nutritional support that parents are getting as well.
And this is to all of you. What more can the mayor do to provide to help them to achieve all this?
I'm sorry, I didn't.
What further support could the mayor provide to help parents to achieve this?
What more can the? I think that through our programme, as David has outlined, there are many different dimensions to that. We do need to work very hard to be able to actually look at the health inequality dimension of this particular programme. Our other programme, in terms of actually our childcare hubs, clearly we'll be looking at the 40% of families who are not accessing the free 2-year-old offer. We need to make sure these hubs actually really do provide environments where they can be attractive to parents, where they can actually model kind of stay and play facilities to make the 15-year to make the 15-hour free 2-year-old offer attractive to those parents who are currently not taking it up. But as Laura said, we can't ignore the fact that there are cultural barriers to the take-up of the free 2-year-old offers. There are issues like ESOL and language issues that we need to look at, and actually being able to actually relate to parents like what the value of this early education actually is in terms of school readiness. Another key issue really in London is the availability of these places. Is the availability of places for the free 2-year-old offer. The amount of funding that local authorities gets to provide 2-year-old places is actually less than the 3 to 4-year-old offer, which makes it more expensive for providers. So there are some inherent issues in terms of the funding model that DAV are offering to local authorities. The other issue that we know is that the amount that's offered to local authorities for the 3 and 4-year-old and the 2-year offer varies across boroughs as well. So it can be substantially higher in some inner London boroughs like Camden than it is for some of the outer London boroughs. So there are some real issues within the local authorities about the affordability of providing the free 2-year-old offer. That we need to be able to actually really give closer examination to, and actually have some more difficult conversations, I think, with DfE, to be able to support the local authorities to be able to actually get the reach to the hardest to reach and most disadvantaged children. And our job, I think, within the Healthy Early Years programme is to ensure that when the children actually are able to access the supervision, that they get the very best and most consistent health advice to make sure that they are actually ready to start school, and there is kind of a parity of both health as well as kind of social, emotional health and physical health of these children when they start school. But there are some really challenging issues within London that my teams need to be able to work through to be able to actually reduce health inequalities.
Yeah, absolutely agree in terms of the financial constraints that are there, and if the Mayor can, fight our corner and keep raising awareness of the fact that the 2-year-old offer, the 3-year-old, the 30 hours is already grossly underfunded, and yet we have providers, and I will say it again, who are on their knees financially and are yet still providing good quality childcare. So let's help them to keep doing that rather than keep putting more and more burden on them financially, please, because they will do it. They will come up to mark, and they will rally to any call to action to support child health. But unfortunately, one element of that is being adequately funded in the first place, and currently they're not.
I think the Mayor can play a vital role in improving the support that childcare settings can provide to parents, and just focusing resources on raising awareness of pre- and postnatal support for disadvantaged communities through this programme, but also through the early years hubs would be really valuable. So as the very early time is recognised as a really key way of getting families to engage in support programmes and healthy habits. So things like the 5 to Thrive programme, or programmes like Bump Buddies run by the Shoreditch Trust, and bonding.
Is that called, sorry?
Bump Buddies. So there's very similar things like maternity mates and bump buddies, and basically making sure that it's sort of peer support for disadvantaged women who are going through pregnancy and for example, Bonding with Babies programme run by Hackney Playbus actually supports women in temporary accommodation to provide them with some social groups that can offer that sort of parenting support. There's, we haven't got onto the links with housing and things yet, but if you think about a mum in a single room in temporary accommodation who shares a kitchen and a bathroom, isn't going to have access to cook healthy food, to store healthy food, that may be why you would turn to easier, simpler, quick solutions for eating that aren't as healthy as possible, because you don't want to spend time with your very young child in a shared kitchen in a hostel. And also they'll be extremely isolated and probably not accessing childcare if they think that this is a temporary placement, even though it might last for 3 years. So, there are sort of issues around that we should explore too.
I don't think I've got anything more to add to that. I think that the only thing I can add to is what the Mayor could do strategically, and I think it's that level for the success. You need to ensure that your other programmes that you're running across London are aware of what's included within Healthy Early Years, what the criteria are, and how you link it, so that if you've got, I'm sure the Mayor's got an air quality, linking that to, we're promoting active travel, walk into nurseries, but those other partners need to be aware of that. And you've got Thrive, and that's another programme, and how the healthy early years that contribute to emotional health and wellbeing and mental health. They're the things, you need to make those links, because really, most of that other stuff can all happen under the umbrellas of either early years or healthy schools, and that, it can all happen under there. So that's it.
Thank you.
Yeah, and again, I don't think...
Final thoughts, Steve?
Yeah, anything really to add, apart from maybe safe spaces for children and their parents to be able to go to physically exercise, and, you know, that they can have those opportunities that isn't somewhere 10 minutes, you know, it's 10 minutes down from their house and they don't have to get on a bus or, you know, go further away. So, yeah.
Okay.
Thank you, Nicky. I mean, we've heard about the challenges facing the providers, and we're going to explore them a bit more, the opportunities and the challenges facing the providers. So Fiona, if you would kindly.
Thank you. I think some of this has already been covered, but as Onka says, I want to talk a bit about the opportunities and challenges for providers. And I mean, Melanie, you said that you thought early years providers would be receptive to the new programme. But what challenges might there be for different types of provider beyond the financial constraints that have already been highlighted?
Okay, one of the beauties of early years provision is the diversity in that provision, and on the plus side, I will say that they already have to demonstrate that they are promoting healthy lifestyles with children, and parents teaching children how to keep themselves healthy and safe. So in terms of the evidence that they need to generate in order to be able to do this, it's things that they are probably required to do already, so it shouldn't be burdensome to them. And they're very good at showing things like continuous quality development, and how that's happening in their setting in order to go through Ofsted inspection and so on. And these things are already written into the early years foundation stage framework. So that's a very positive thing that's happening. So, you know, again, we can make this work, definitely.
Laura, if you've got any comments on other issues and how receptive people might be.
So, you know, obviously a solo childminder will have less time available than a nursery chain, for example, and if they're time limited, then compliance will come first. So yes, absolutely, they have the early years framework, the healthy early years framework that they need to complete, and so why would they go over and above what they need to do for compliance? It's just a question of whether the voluntary scheme would be sufficient to tempt them to do that, or whether it sort of becomes almost a status badge for outstanding placements that would be doing it anyway. But as you say, you know, if you don't give it a chance to bed in, then you can't bring standards higher. So you know, it's worth trying.
You said the barriers, didn't you? I think I've got 4 barriers, and each one is time. Have they got the time? Is it relevant? And the one from that is actually showing that the main key one for us, apart from our experience of improving the health and well-being of those families, is the fact of linking it all the time to the criteria of the early years foundation stage, and to providing evidence. And they've got it then in one document. They've got other stuff, but this is one document. Is it achievable? You don't want to. It shouldn't be too easy, but it shouldn't be at such a level that they can't get there. And is there support? And so they're there.
Have you got anything to add?
Yeah, I think again it just comes down to actually if they've already got evidence for other organisations, so Ofsted or Soil Association or Environmental Health, you know, they would have already been environmental health inspected as well. Then do they need? It's that whole thing of providing additional evidence. So that might be a constraint for people who, when they are already doing lots of other childcare things, like their planning, their reports, other meetings, that might be, it's again time, I think, and documentation, some of them.
Sorry, I forgot to say there is also a massive recruitment shortage.
Yes, there is.
So given that there aren't enough staff to provide the places that we need, then is there enough? Will there be enough staff to do this as well?
And Amanda, what discussions have you had with early years providers in developing the approach from all parts of the sector, so private and independent as well as publicly funded?
Okay, so the pilot we ran actually has representation for all of those three areas. I think one of the things that we have seen as a result of this programme is actually that the pilot in those boroughs that we've been working at, it's been a real catalyst for joint working between the education and the health parts of the local authorities, and with health being a relatively recent addition to local authorities' remit, this has really fostered up a very close communication across those two areas that we think will both raise education and achievement, but also actually stimulate the education element of local authority work to be more holistic in terms of their approach. As I said, the pilot has worked with a range of different childcare providers, everything from childminders right through to some of the nursery chains, and we've been very cognizant when we've been looking at the various different categories of award to make sure that is applicable to each childcare provider. So what we can require from a chain or a multi-site business will be very different to what we will require from a childminder, who we recognise has more constraints on their time. I think one of the other things, as David mentioned, we've been very careful to make sure we align what we want from these providers to be able to actually meet some of the Ofsted requirements, so that it doesn't provide an additional burden on these businesses. And hopefully this type of reward will become very prestigious, and it will be something that the industry will aspire to and recognise, and that parents will look for it over time as a mark of quality, so they can have a further assurance that when they entrust their children to those providers, that there is really good standards, and that their children will be able to actually have a good awareness and the foundations of very good health.
So would the main incentive be recognition, or what other incentives do you think there'd be for early year providers to adopt what is after all a voluntary framework, when people already said that there's quite a lot of paperwork people already have to do?
We're trying to design a scheme that will make it easier for businesses to be able to collate that type of information in one place, in the sense that they have to do it already for Ofsted. But how do we provide them with a series of resources that makes it actually easier for them to do that? And then hopefully part of the scheme is to accredit them with a certain standard, depending on the effort they want to actually go to in terms of training their staff, in terms of actually upskilling their organisation with the key tenets of good health.
Thank you. David?
I think the other thing there with the early years is the value of it. It's not just the award, it's being able to know they're making a difference.
Yes.
Quite often we do different interventions and we do them, but we don't actually spend the time to think why we're doing them and are they working. And the silver and the gold in particular aspects of the early years, like healthy schools, they do that. They do a lot more work around understanding why they're going to do it, setting data so they can see if it's going to make a difference, and at the end of it then coming back on that, and they really appreciate that, and that's the thing they get very excited about, and they want to share with both parents, partners and other settings.
Okay, Melanie.
I can just say that we know evidence tells us that it is good and outstanding childcare provision that makes the biggest difference to children's outcomes. So it's not just about compliance in terms of being able to tick a box, but Ofsted and everybody involved is looking at ways in which the sector can continuously improve what it's doing. And it is about engaging with things like this, that, it's not just, oh gosh, it's more paperwork. It's about saying, do you know what? This makes a difference. And this is what we are all about in early years, is trying to make that difference.
So at the moment, and it's been mentioned before about sort of the issues around people being on their knees, and I quote, is it realistic to expect people to take this on at this point in time when the sector's already struggling with the 30 hours?
It's something that they're already doing. They're doing it day in, day out without even realising that they're doing it.
So it's giving a structure to something people are already doing.
Yeah.
Okay.
I think the other thing that's really worth bearing in mind is when they've got an early years coordinator, whatever is going and meeting with them, you're going in there as a critical friend, and you're not going in there like an Ofsted inspector and sort of judging them and saying this is not working. You're there to acknowledge what good practice they've got already and suggest others, and they really appreciate that as well. So you know that someone's taking the time actually to go in there and chat with them about what they're providing and about maybe how they could change it and improve it, and they appreciate that.
Okay, thank you. Amanda, what analysis has been done of the potential costs to early years providers of adopting the framework?
We have looked at what the Ofsted requirements are, and through the various different levels. Clearly, on the higher end in terms of the gold and silver, there is some investment. We believe that the investment is primarily within the staffing and the education to the childcare practitioners, and clearly we think that is largely, funded as part of the core costs of running really good establishments. So we don't anticipate that it adds a huge degree of cost, and we do believe that actually the impact that will have on the children and also the value of this accreditation will offset that. But perhaps Melanie, you could give a view on that too.
Yeah, I agree. Actually, I don't think it's so much that this is about additional costs to the setting, because they will incorporate it into what they're doing. They will also be able to recognise what they're doing and how it contributes to this already. And I've said financially the settings are on their knees, but that doesn't mean that they still aren't doing it, because they are.
Thank you. Any other comments on that point before I ask Amanda? I think I've got one more question for Amanda. Okay, thank you. So this is a crucial question, Amanda, and I think it came up in the what further support could the Mayor provide. Will providers be able to access any funding from the Mayor to support their work to improve the health of their settings? Is that part of the plan?
That's currently that's not in the scheme that we're currently looking at. So our scheme at the moment will be voluntary. We will seek to engage the local authorities to help and support us to be able to roll out their model across the city. We do believe that the support we get from local authority is absolutely key, because they are the ones who actually are able to help us with the targeting of the programme. Because we do want to be able to target our programme to be able to stimulate interest from those disadvantaged areas to get them to take up the free 2-year-old offer. So at the moment it isn't a scheme that's actually where we kind of subsidise the providers. But we will be talking with the local authorities in terms of actually we co-produce how we manage the scheme to give it as much targeting as we possibly can, to be able to focus on those who will really benefit and where we can actually make the most difference in terms of reducing inequalities.
Okay, Laura.
So just on that, obviously through accreditation you do mention that there is the targeting of particular groups within communities, and I wonder if the programme could stipulate a focus on improving the health of the lowest income families, and that might be a way to sort of help all of the childcare providers focus on the low income families in their area, and they at the moment can be identified through early years pupil premium or the 2-year-old funded hours, and I don't know whether the scheme can help local authorities focus the sort of more targeted spending from their funding pots on the deprivation supplement, and so that settings could provide children from disadvantaged families more as part of their. I don't know if you saw the news recently about a setting saying that they do provide free 15-hour places, but they would have to charge £15 for lunch for that child, or the mum could come back and pick up the child for the lunch hour, which, you know, isn't really a very workable solution. And so, you know, making sure that a free offer is really a free offer is part of the way that this programme could support. But
who monitors that? Because that's actually a really crucial point, because for the 30 hours to actually give the benefit it's intended to, it has to be something that doesn't have a gap in the middle. I mean, that's just completely counter to everything anybody would say when they were talking about it from a policy perspective. So who would monitor that, and how can it be made to work effectively?
Well, the funding isn't enough for the nurseries, so they have been encouraged to find other ways to make it work for them. There is a big role, I think, for the GLA in terms of data collection. I know it's really dull, but you know, we really do need a deeper understanding of how the 30 hours offer is affecting the marketplace. And not just for the 30 hours, because obviously that is for working families, but anecdotally what we're hearing is that the places that the 30-hour funding is going to are people who are already accessing nursery already. They're just now they're getting a bit cheaper childcare. If you want to help the most disadvantaged groups move into work, then it's about whether the 30-hour offer is affecting the number of 15-hour places that are available for disadvantaged 3-year-olds, and obviously the free offer for 2-year-olds. So one of our members is a provider and is committed to providing whole site provision that is just the 15-hour offer still, so that the 30-hour provision doesn't push out those 15 hours. But, and so, you know, that sort of data collection on how it's impacting the other elements that are on offer to disadvantaged families is a really important part, and we don't know. You know, it's not easy, is it, across thousands of providers to know who's charging extra for snacks, who's charging extra for lunch, who is saying you can only have mornings with the free hours, which means that, you know, you really only got 2 hours to do a job with a commute either side. So, you know, it's not working for parents. So there is still a lot to understand about that.
I'd just say that the Preschool Learning Alliance has already done quite a deep analysis of the reality of the 30 hours. We've got 14,000 members, early years provision, across the country, and we've already spoken to them and getting feedback from them, and, you know, we're calling the government to account on this constantly. So there is evidence out there already that needs to be looked at again, please.
And it's a bit like Laura was saying earlier, the free hours actually only cover your childcare and not meal times, or include the provisions, buying food, and for a lot of sites, the hours that the 30 hours give don't actually even pay for your staff to actually do their job. So anything additional is then being charged to the parents. So,
I don't have the numbers, but there are childcare settings, there are childminders that are leaving the sector because of the 30 hours, and that's the last thing that we need.
Yeah, so again, we did a study earlier in the year about the impact of 30 hours, and, you know, huge, like 75% of providers were saying that their costs for other things were going to have to rise.
Exactly.
And also there is obviously the problem of childminders closing.
Thank you.
Thank you, Fiona. So we're going to now just start thinking about inequalities and how we reduce them.
We'll start talking about that.
And so I'll ask Susan to take over that.
Yeah, I mean, clearly we're all concerned about this. It's been a thread going right the way through this morning. Amanda, if I just say to you, how will this programme support the reduction of health inequalities in London?
Yeah, so specifically, we need to make sure that this programme is actually targeted at those who are most disadvantaged, and we've got some lovely ideas from Laura in terms of how we can do that. we need to work with the local authorities on that to be able to get this targeting right. I love some of your ideas in terms of actually some of the roles that we can play in terms of data collection. We are doing a wider piece of work on childcare and looking at some of the issues to do with that industry or that sector that are putting incredible pressures on that. And you know, I mentioned some of the areas in terms of actually just the funding formula for for nurseries, and just the huge variation between what local authorities actually get to be able to do that. We want to make sure that the scheme is actually robust and actually does deliver the impact for the child, and then we need to be able to actually make sure that we get as many disadvantaged children being able to actually be recipients of this particular
but how
program.
are you? How? I mean, we've touched on all this. If you delve deeper, exactly. I mean, you've said extensive work has been done. Exactly how are you going to do that? Specifically for disadvantaged children.
So the way that we want to be able to do that is to actually increase the number of children from disadvantaged backgrounds who actually take up the free 2-year-old offer and the free 3 and 4-year-old offer, so that we can actually be able to actually give them exposure to this type of program within the early years setting.
So what are you going to do specifically to do that?
Okay, so we're doing 2 things to do that. We're setting up the 3 childcare hubs across the capital.
And where will they be located?
We're in the middle of tendering for that, and we should be able to we'll be making announcements in terms of where those 3 childcare hubs will be situated in the new year, after Christmas.
Right. Okay. What progress then has been made in identifying these children and their families?
So our scheme is about supporting the sector. Our scheme is actually built on the platform of actually working with local authorities who have the statutory obligation to be able to provide childcare settings, but also who are supported, especially those most disadvantaged, who actually are supported at local level. So it's the partnership between this particular programme and the local authorities which will allow us to give this programme the targeting that we want to see.
But do you have a rough idea of where they are in particular?
Yeah, well, we do. I mean, we know the wards where where children in poverty are lived. We have we know the distribution of those children, and it's just about ensuring that the nurseries within those particular areas actually are the first ones we target through a programme like this.
So the evidence of that will all be published, will it, so that we can all see that?
Yeah, we'll certainly be looking at this programme through the lens of inequality to understand what proportions of our children are getting exposure to this programme. Yes, absolutely.
And the hubs will be in the vicinity of those children in particular, will they, or the families?
So what we've done in terms of our childcare hub is that we've invited providers to come forward to make an application to be one of those 3 childcare hubs in London, and we're in the process of assessing those applications at the moment.
But there will be, I assume, near those in greatest need, because the one thing that is concerning, I'm sure, to us all, is that the difference between those that have and those that don't gets even broader, and we really don't want that. We really must be looking at the most disadvantaged. In times when funding is short, etc., and we're all having to watch things, it is absolutely upon us all to look after the most disadvantaged. So I would have thought that we really need to know exactly where they are and exactly how we are going to get them engaged, or we are going to go out to bring them in, as it were, and that we concentrate all thoughts on funding and anything else we've got on the most disadvantaged. So therefore, I'm disappointed that if this is being launched in the spring, so we're only looking at a few months, the hubs aren't there, and there is no clear plan, unless I'm missing it, of exactly how you're going to draw the most disadvantaged in.
So both of these programmes work together. The hubs will be in place and they will be operational before we launch the Healthy Early Years programme. I just don't want to get too caught up in terms of where they are rather than what they do. So we are looking for the very best providers who can actually target those children to be able to actually increase the 2 and 3 year old offer. It is likely that they will be adjacent to areas of greatest deprivation, but we're looking for the providers who can provide us with this the most amount of evidence to suggest that they're going to be able to deliver the impact we want from those childcare hubs.
Well, I would suggest where they are is quite important.
And it is important, but that's, you know, it is one of the considerations that we're looking at when we choose the providers of those childcare hubs.
So, to the rest of you, how well equipped are London's early years providers to work with families with complex needs, and what further support would help?
Early years providers are already working with many families with complex needs, and as local authorities have had to be very targeted about where they put their resources, we are finding that we are getting more and more children with complex needs in early years provision, certainly with speech and language, you know, and other behavioural problems as well. And so it's an issue already that we're addressing, and we're working with those children, those families already in early years provision. And again, it's about the practitioners who are professionals in their own field and are more likely to be acknowledged as such now than they ever were before. But I just think that we all have to recognise that the level of need that we're already meeting in early years settings.
There isn't enough provision for families with children, with disabled children. It's an ongoing struggle that families face, getting that kind of care. A provider in our network told me just last week of a family who came to them having been turned down from a childcare setting for meeting the needs of their disabled children. So it is something that families are struggling with.
But which they shouldn't be doing, because with the Equality Act they have a duty to be able to, you know, not turn away children who have a disability and to actually meet their needs.
Yeah, but it does happen.
It does happen, yes. Yeah.
Can I ask a follow-on question to that specific point? Because a few years ago I was involved in campaigning for something that's now law about sort of rights of access for disabled children in schools. Does that not apply to nursery settings as well?
Yes,
It does. Yeah.
I suppose it depends on the agency of the parents and how willing they are to pick up that fight.
The trouble is, the most disadvantaged families are going to be less able to really take on a fight with them.
Absolutely. Yeah.
So part of the role of the childcare hub is to actually equip parents to be able to understand what their legal rights are, to be able to understand what benefits they can access, to be able to do that, to be able to ask the right questions from the childcare providers. I think it would be very useful perhaps for me to actually give a briefing to the Health Committee in terms of actually the childcare hubs and how they actually relate to the work we're doing in terms of healthy early years, because they are specifically designed to be able to give parents the agency to be able to actually get what they need for their children and to be able to not have to fight, but to be able to actually not necessarily to have a fight, but to be able to actually demand that they have access to really good childcare that's appropriate to the needs of their children.
I think there hasn't been sufficient support up until now, and I think that's
I agree.
great thing for it to focus on.
Yeah, we have a number of children in our settings up and down the country who do have additional complex healthcare needs. Some of those children might actually have lifetime nurses with them on site, so we will do that, but I know for very small providers who might be in a scout hut where they're packing up and doing things every day and they've got stairs and things like that accessing, they might say no to a child who's in a wheelchair or things like that. But as long as they have children who have speech and language delay, they are meeting the requirements of having children with additional needs, if that makes sense. So yeah.
So parents should be given more information, but is part of the problem that not all providers are clear on what their responsibilities are, and that's why people are getting turned away? I mean, would that be fair?
I would say so from my experience, and I would say that sometimes some settings are too scared because they're worried that they might do something wrong to a child. So I know that I've had some children that I've supported some of my nurseries with who have diabetes and things like that. And again, a parent actually came to us and just said, oh, we've been to 6 other daycare settings and they've all said no because needles are involved. And we've just gone, no, that, you know, we'll get the appropriate training and things like that. But again, it's about the settings having the confidence to access the resources for training if they can.
Can I just ask, where would a parent go in the circumstances where they haven't? Who would they talk to? Who would they lobby? Who is the responsible person? That's a question.
What, in the local authority, early
Local
help?
authority.
Yeah.
They go to early help team.
They would go to their
There's the early health team within the local authorities, and also their health practitioner, especially for children with very complex needs, should be signposting them to the type of local services that they should be accessing. Now we know there's probably variation in terms of that, but certainly in core programs like for children suffering with diabetes, those that type of information and advice is definitely there to support parents to be able to navigate their way through childcare settings.
I'm just constantly fascinated
No,
that
it's
where
interesting. I mean, it was
right,
when I worked for Diabetes UK,
you know,
and it was
they can't get
issues
it.
about children getting excluded from school that sort of led to a sort of setting up a coalition around it, and sort of after I left, sort of finally got success. But I think that it's hugely complex, and I think it's just really important that we don't underestimate the pressure and difficulties for parents of actually sort of asserting their rights and looking at what can be done to make sure that actually they don't have to assert their rights in the first place, because when they go to the providers they don't get turned away by 5 because somebody's concerned about needles.
And also if you've got a good disability organisation locally, then they'll probably do a battle for you, but of course they shouldn't need to battle.
No, absolutely.
And the other thing that I would say is that so often what happens in early years is that the complex needs of a child aren't fully recognised until after that child has started in the early years provision. And that is part of the problem, that we need to be able to do more, to be able to work with parents to recognise a child's needs and be able to steer them in the right direction before they actually start. And then you don't get into a situation where you end up thinking, my goodness, we can't meet this child's needs, and we have to talk about, and I hate to say the word, excluding them. Because that goes against everything really that early years believes in. So we've got to do more about making sure that those needs are recognised in the first place, and that comes down to having conversations between health and education, definitely.
So if people have an issue, they can go to the hub, can they? Is this what, or do people from the hub go out to parents?
One of the functions of the hub is to actually support parents to be able to access the care that they need from their particular children. With children with complex needs, within some of those pathways there are some very clear...
but where would the parent go? Would the parent go to the hub, or would people from the hub go to the parent? What
our plan is for the hub to actually reach out into the communities to be able to access the parents, so that we can actually give those parents as much agency as possible to then seek the childcare that they need. But I think it's going to be a mixture of both.
So
but there's certainly some outreach.
Will these hubs be advocating for these parents?
They will be providing the parents.
I mean, there's a lot of I speak as a medical practitioner right here, and I see patients every day in my surgery who know what their rights are, but they can't get them. And who's going to be the advocate for these people? I mean, they come to GP surgeries who say that our problems are, we're already overcrowded doing other things. Who's going to hold their hands is what I want to know.
Quite often the early years provider will be the person who is trying to do that for them.
But sometimes they say we are unfunded, or this is a 6-month waiting list, or a 12-month waiting list. But someone has to, and some of these parents aren't articulate enough to be able to voice those needs and to go to the right people. And that's what we need. I think there isn't sometimes a lack of information. It's someone who's going to be holding their hand to do this.
So what's the answer to that, Amanda?
I think it's a very complex issue. I think there's certainly a role for the local authorities to be aware of those families who have children with complex needs. I think there is definitely some advocacy and signposting within some of the care pathways. So, for example, with asthma, children who suffer from asthma, there's some very clear pathways and also instructions for early years settings and for schools. I don't think we can underestimate the incredible work that the voluntary sector does to be able to support and advocate for parents to be able to seek the services they need for their particular children. I think that within these type of programs, we can make it very clear to the nurseries in terms of what we want to see for those children who have complex needs, and we can build that into the criteria, and we can play a very valuable role in terms of educating practitioners about how to meet those needs, and actually how to work with parents to be able to give support to parents to be able to do that. I think that's especially important as children transition from early year settings into mainstream school as well, and our scheme within some of the accreditation models can look to provide that sort of advice, information, and guidance.
Can I ask? I'm very concerned because it's so near to being launched, and I mean, I accept you're constantly saying it's very complex, and it is. I get that, but we're so near to launching something that is supposed to, provide some answers, etc., or some clear guidelines, and we seem, from my perspective, we seem miles away from that. How will you measure and monitor the uptake of this particular programme? We will have an in-programme evaluation for this particular programme. We want the evaluation to run in an integrated way. So we will be looking for to be able to measure that with the providers and recipients of the programme. I don't want to give you the impression that the programme is going to fix everything. It's not. Some clear guidelines would be. Yeah. I mean, performance indicators.
There will be performance.
What you're looking for. I mean, we particularly want to know whether those from disadvantaged families are being sought and brought in, because then at least that would be a good outcome. But we really want some targets, outcomes. Will you be publishing your findings as you go along?
Yeah, I mean, absolutely. We want to be able to share what we're seeing, what we're learning as the programme evolved. There will be indicators in terms of KPIs and targets associated with the particular programme. We'll be looking to share those with the Assembly as we publish the delivery plan for the health inequality strategy. We want to be able to show you through those indicators and key performance indicators that the programme is actually looking to target and reduce inequalities. It is one of the key programmes that we're hoping to be able to achieve through this. The other thing probably worth mentioning is this is probably the first early years programme across the city that will be delivered. So we actually are breaking some new ground. We have to be able to work with stakeholders and with early years providers and with local authorities to be able to inform that and to inform how the programme evolves and develops over the years that we implement it. We do feel a deep sense of obligation that we have to be able to provide those indicators to be able to actually evidence the impact that this programme will have on the children within those early years settings. So we will be tying it back to some of the public health indicators that the local authorities are obliged to produce, and we will be working with Public Health England to be able to benchmark where our programme is actually delivering and actually how it is actually demonstrating that impact on children's health.
And I hope you find where these families are. I mean, in the September meeting, Yvonne Doyle, the Mayor's Health Advisory, as you know, said what we do not have is an understanding where individual children and families are, talking about those in the most need. I mean, that is very concerning that was in September. So we will, I think, Chair, we need to be keeping an eye on this because, sorry, Laura.
Just on where those children are, I know that like local authorities get data from the DWP on the children in their local authority who are eligible for the 2-year offer, but they can only access that data for a time-limited period, like 3 weeks or something. They have access to the data to say where those families are in order to recruit them to come into the childcare settings. But then the rollout of universal credit is going to alter how that data is provided, and so some of those families might fall off, I've heard. I don't know exactly how that, but it's something that I guess if you're going to start looking at the data collection and how local authorities are identifying families, that's something to be aware of, and whether how universal credit data is provided will impact on the identification of those children.
That's really, you obviously have looked into this and you must have known that. So what's your response to that?
We work with the local authorities and actually the local authorities through their joint needs assessment analysis actually make that make the decisions in and around the funding they provide the poorest families within their localities. This programme is predicated on working with the local authorities to be able to get that targeting right. And we will support the local authorities to work with us to be able to be networked with other local authorities to be able to actually share the best practice of how it's done and how it's done really well. We'll be looking to encourage other local authorities to be able to adopt similar processes. To be able to actually really drill down into the data so that we can actually understand who our programme is actually targeting and who our beneficiaries are. And we'll need to do that in partnership with the local authorities to really make sure that we can get as much and as deep an outreach to those parents, to those families who are living in poverty. And it is really complicated. And it's really complicated because not only do we have families who are on benefits, but also, we see families which genuinely have low income, and they're in the same sort of poverty bracket. So that interaction with the local authorities to be able to get the targeting is absolutely key, and that's one of the key things that has come through the pilot. In terms of actually how we work cooperatively with boroughs to be able to actually get the reach into our programme.
So this was the Chair. I share the observations of Assembly Member Hall. I think we've got to inject some sense of urgency into this debate. I'm quite mystified about this observation that we do not know, we do not have an understanding of where individual children and families are, with all the data, the geographical indicators. And I struggle to actually come to grips with that observation.
And if it hasn't been picked up by the joint needs assessment, then we're missing them. Okay. Well, we now come towards the implementation. Okay, I mean you have been piloting this in 6 boroughs, so there must be some learning.
Which are the 6 boroughs?
Tell us who the 6 boroughs are.
Unless I missed something.
I have it in one of my notes, so just bear with me a moment and I'll... They are Croydon, Tower Hamlets, Lambeth, Havering, Southwark and Hounslow.
And what? Hounslow? Did you say Hounslow?
Hounslow, yes.
Okay. Thanks. So, what were the pilot programmes aiming to assess, remember, and how were they evaluated?
So the pilot programme, just bear with me a moment, the pilot programme was looking to assess, just Bear with me, I'm just getting my notes. So building out from the literature review we did, and on a wider London stakeholder consultation which we ran in 2016, we were looking to pilot this particular programme. And just bear with me a moment. The wrong piece of paper. We were looking to actually look at the Healthy London, the Healthy Early Years engagement in terms of different types of settings, including the type of support, facilitators, and barriers to engagement. We were looking at specifically what the benefits of this particular programme would be for the boroughs as well as the settings. We were looking at the support needed for the local authorities, and this is particularly key, especially if we're going to get the targeting right to those children who are most disadvantaged, and looking to see what support would be required at the boroughs, and also what training and support would be required within the settings. We also wanted to look at the effectiveness of the programme in terms of actually the impact of the programme, but also the cost effectiveness of the programme, and also the user friendliness of the programme. And also we wanted to actually look at to build out from the clear theory of change work that we did to actually make sure that the programme would have the health impacts that we wanted to see from implementing a programme at scale across the capital.
Now that we know what you are assessing, how are you evaluating it?
So this is a pilot. So what we wanted to...
But even piloting evaluations?
Yeah, yes, we have, and we have made an assessment of the pilot. So, as I say, we looked at 6 different boroughs, and we looked at implementing the pilot in over 60 different settings. We know that the pilot, actually, as I said before, was a catalyst in terms of actually joint working across the local authorities between education and health. We also were looking within the assessment in terms of what we saw in terms of actually the responses of the childminders as distinct from bigger childcare settings. And we wanted the pilot to actually inform what were the types of criteria we wanted to see within the 4 stages of the scheme we were developing. We were very clear that we wanted the pilot to actually be able to build out from the Ofsted framework, and to make sure that the bronze, at least the bronze accreditation, actually reflected that. And we wanted to make sure that there was a clear self-review framework within the bronze element of it, helping to create those kind of better links between the settings, children's centres, and health and care and parental involvement. We also wanted to make sure that we could have those conversations with local authorities in terms of their investment in early years, to make sure we got the targeting of this particular programme.
Susan, you want to come in?
So in these particular boroughs, have you identified there where you've got the families that are in the most need?
Yeah, so we have had conversations with those local authorities in terms of their role in helping us to target that.
No, have you actually got the names and addresses of? Do you actually know where they are in those 6 boroughs?
Sorry, do we know the names and addresses of the children?
Have you absolutely identified all of the children that are the most disadvantaged in those boroughs? So our scheme works with the providers. And the providers actually are... But it's to encourage people to go to providers. Yeah. So a little bit what David says in terms of actually, we want the local authorities to work with those providers in the most disadvantaged areas, because those providers in the most disadvantaged areas will pull from a local population of children who are living in disadvantaged
But were you, in those 6 boroughs, were you able to target those children who are most disadvantaged? Was that one of the things you were assessing?
Yeah, we were looking to work with those local authorities who were targeting in those areas. Yes.
But did it work?
We worked our programme with those providers in those particular areas.
The question is simple. You tell me that the 6
were we able
boroughs.
to access those children? Were we able to access children who are living in disadvantage? Yes.
Okay, so you were able to identify those children who were most at disadvantage, and you were able to encourage the providers to reach out to these people.
The providers, so perhaps I'm not explaining this very carefully. We were working with providers who are in disadvantaged areas,
yes.
And by nature of their geography, they have disadvantaged children within them.
Yes.
And within those provider settings, we were working with practitioners,
yes,
to be able to improve the health outcomes of those children.
Can I just technical? I'm getting confused now on whether or not this is a geographical targeting or it's targeting to a particular child. Because in some areas, say of Southwark, you can draw a line around an area and have the most disadvantaged and the most advantaged children in a very small geography. It's the nature of London. So, which is it? What are we doing? Is it? I'm a bit confused as to how we're targeting these children.
So we work with providers.
Yeah.
And we work with providers to be able to get them to actually raise their standard and to be able to take a holistic view of the child's health. We also work with local authorities who implement the scheme for us to be able to actually target those providers who have a larger cohort of disadvantaged children.
So the GLA is working just with providers, not necessarily targeting the children themselves. So we just know which providers we're going to. We don't know their names. I mean, to go back to what Susan Hall was saying.
Know their names. I mean, that's confidentiality. That's data protection. I think that's a ridiculous statement.
No, but the issue is this: there's so many. If children are lucky enough to go to our providers, and we all accept, they're fantastic. They are at least in with a chance. The most disadvantaged children are very often those that haven't been put in touch with the provider. And that's what we're concerned about, the amount of children out there that don't have any access to a provider in the first place. Because if we can cure that and deal with that, we have got great faith in our providers. So if they're given a disadvantaged child, they will certainly work with that disadvantaged child, no question. It's the children out there that don't have access.
Wouldn't that be the council that would do that?
But this is why we're wondering whether this scheme has got.
Isn't this going beyond a healthy early years programme? You're talking about something now where you're actually wanting to make big social change. For that, you've got to have the funding in there. You're putting I'm sorry, but it's a small amount of money to run a healthy early years programme across all the boroughs. It's not as if you're going into, all you're asking is settings to get an award. That's what you're basically asking, and to demonstrate good practice. If you're wanting to engage all those children, all those poor families and everything else, you've got to put a lot more money in, you've got to get together with all those different boroughs and to identify it. And I think you're going way beyond what your expectations are for a healthy early years programme.
That's your view. We're concerned about these.
I understand your concerns.
This is crystallised the issues here very clearly. Thank you for that, David. So, what was the learning meant that we've had from the 6 pilots you've had? What's the learning been? And that's the first question: has there been any learning from it? Did you need to change anything in the scheme you thought of putting forward? Did you make any changes to it?
Okay, so the learnings, so what do we find out? Both the borough and the programme leads and settings were very positive and enthusiastic about an early years award programme. They were very able to, they could clearly see the benefits for the children. I think from our point of view, most importantly for the families and for the early years practitioners. So the programme was seen to be able to add value to the work that they do and to allow them to actually impact both the children and the wider families. there was a consensus that our programme, in the way it's conceived, actually is appropriate for areas of health, well-being, and the wider education. It was a relatively short period in terms of what we ran the pilot. It meant that that the settings were able to kind of certainly progress through first steps and on to bronze award. But because of the time duration of the programme, we haven't fully tested the silver and the gold. But that's purely an issue of timing and the short timescale of the pilot. We know that the first steps provided a useful starting point, and we know that first steps actually stimulates providers to become interested in thinking about the whole child health.
Okay, so listen to you, Amanda. You haven't had to make much changes. What you put out, it seems to have worked right from your perspective.
I just haven't gone on to it.
In terms of you can send those papers to us, right? Remember, I'd rather use our time having a discussion with you.
We have made changes.
Yeah. So tell us what changes are, please. What you've written down, you can send in to us as written evidence.
Okay. And I can do that. We have looked to make the first steps a bit shorter and to simplify the registration process. We're looking to reduce the requirements of the Bronze Award to be able to stimulate that step between first steps and bronze. We will look to make more strategic investment in the boroughs to ensure that sufficient resource is available for that local rollout, and I think that is really important in terms of the targeting of our programme. We will look to develop a very effective induction and ongoing support, including revising some of the materials and the resources that we will actually provide for the settings. And we will be looking at how we work in collaboration with the boroughs across the early year childcare hubs to be able to get as much targeting as we possibly can to be able to actually to be able to get our programme to reach those most disadvantaged children.
Okay. So, and what is the rollout programme now? What's the implementation programme now, and when does it start?
So our work at the moment is to fully integrate the learnings from the pilot that we did at the moment. We are working on producing the resources that the early years in childcare settings will require. We're looking to build the web pages and technological infrastructure to be able to roll out at scale. We'll be testing those in terms of a soft test before the actual announcement and an official rollout, an official announcement of the launch of the programme. And we'll be doing all of that testing and all of the programme set up at local authority level prior to the launch.
And your launch date is, I think you said earlier, was it by April?
Spring is what we're looking for at the moment, and we're just waiting for confirmation dates from the Mayor's office on that. Okay.
And how will you judge your success around? But how many settings do you think you might reach within, say, 12 months of starting this off?
So that's the piece of analysis that we're doing at the moment in terms of actually how do we put some targets in and around this particular programme. Yes. How we're consulting with kind of local authorities and the settings, looking at the key performance indicators that we can reasonably assess for this particular programme. That's complicated quite simply because there's different providers in terms of childminders versus local authority settings versus the chains. So that's the piece of analysis we're doing.
And this all your targets, your criteria for success. This will be all made public.
Absolutely.
Before the launch.
So what we'll be doing is actually agreeing with the Mayor's office the key performance indicators they want us to agree with this particular programme, and then we will be making those
public. Surely the key indicators should be the ones which may give us success, right? Not what the Mayor's office wants.
Well, when the key indicators actually
100%.
they indicate the impacts that we're trying to actually make for these particular children.
Yeah, I mean, all I'm saying is that the indicators need to be important, that we do measure the improvement we bring in children's lives, right, rather than just indicators for the sake of indicators. That's what I'm driving at. If you get the wrong indicators, then you get the wrong focus and the wrong outcomes.
Yeah.
Okay. This is probably the last. This is an opportunity for all of you to come in if you want to say if there's some comments you want to make, something which we have forgot to ask, or you think you really want to make a point before we conclude this part of the meeting. Was there anything you wanted to say, any one of you?
Just, I hope that we will, or you will be able to look to some of the schemes that already exist and to learn from the good practice that's already happening out there. And as I said before, look at ways in which this can be integrated into what you hope to achieve.
Thank you. Laura?
Just that we welcome the strong focus on supporting parents and getting parents involved early, as early as possible. And obviously from my position I'm going to encourage the targeting of low-income families, or ways to reach them, but the programme has value in itself, and I think it's a really good step forward on behalf of the Mayor to have a vision, particularly around tackling childhood obesity and things like that.
David?
Yeah, it's a great idea. I think it's I think it should happen. I think it should be. You need to be realistic with what your expectations are. And I think that if you're looking for real change, you're not going to get that for 3 to 4 years. Because, the first stuff, if you're getting into it, the first thing is engagement, it's getting the settings on, it's getting them to change basic practice and putting all that in place. But if you want to real measure outcomes at the end, they've got to get onto the next stage, they've got to identify what those outcomes are, where they're going to want to change it, then they need time to implement that. And you do not get that overnight. That's going to take time.
Nicky, you want to say?
Yeah, I would agree that it's a really good starting point and something for everybody to work on. And I think, like we've discussed, it is one of the first things that has focused on the early years and the partnership with parents. For a very long time, it's normally been focused on schools, and like we've discussed, by that point, sometimes it's unfortunately too late. So I think this is a really good opportunity for us all to be able to support parents and children.
Yes, Menda.
It's been a really it's been a really a comprehensive journey that we've travelled in terms of defining this programme. We've been really grateful to some of the local authorities who've been so generous in terms of sharing their expertise, and also to some of the wider stakeholder groups that we've worked with. So I really appreciate some of the comments of the panel today and some of the people who've really helped us shape the programme. We'd really like to invite Assembly members to actually come and visit one of the Healthy Early Years settings, to see for themselves in terms of the tangibility of the programme, and also to be able to see the potential that the programme can have in terms of improving the health of the children. It's been great to have the Assembly look at this. We'd really invite your wider engagement to help us promote the scheme across London, and especially those geographical Assembly members, to be able to promote the scheme in those nursery and childcare community settings, to be able to actually get childcare settings to be able to adopt the programme. We will be coming back to you with more details in terms of actually how we're going to measure the programme, and how we're going to target the programme. And I think I'd probably like to finally end on saying that it's a very innovative programme. We're really learning, and we really want to be able to share that learning with the Assembly, and we really want to be able to share it with the local authorities so that we learn together about how we actually improve the health of the children. We do recognise that we have a task to be able to actually to really target this programme. This programme sits within a wider suite of health programmes, looking to address childhood obesity and the other wider determinants of health. And whilst it isn't a panacea to fix everything to do with child health, we recognise that it's part of our journey as a city to be able to promote the health and wellness of our children.
Well, first of all, Amanda, I want to thank you all for all the hard work you do and all the Millard team. And also that we want, the wheel is behind you. We want you to succeed. That's why we're scrutinising today, so we can make it work for you, we work for Londoners. It's a very, very critical area, and getting the early years right will set up the adult life for those individuals. So we wanted to succeed, and I congratulate the Mayor for taking this initiative, and the wheel is behind you. So we just want to make sure that it happens. And I want to thank all of you for your contributions this morning. And also, if you think of anything else, you think we missed something, we forgot something, or you wish we said this, or you've come across another piece of evidence which you think will add to our thing, then please let us know. We're open to everything. Anything we can do to make this a success, we want to hear about it. So thank you very much. We have now about 5 minutes break while we reconvene the panels. Thank you.
Thank you.
GLA, Committee Room 5, sound. 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 GLA.
It is cold in here, actually.
Oh,
We'll end up with the
you know
flu.
something? I've just said.
This is a health committee.
I'm from Aberdeen and I've never been so cold.
That's really worrying.
There's only one press school that ever did, Peterhead.
Peterhead. Peterhead, the blue tune.
You're less
I just want to tell you that the mics are on.
But so,
you're less radioactive.
because you
If
couldn't
the
talk.
mics are on,
I
then
spent
somebody
one
put the
Christmas.
heating on.
Born in Payne.
Okay, well, look, can I please welcome our panel 2 guests, Kenny Gibson, Head of Public Health Commissioning London, and also Daniel Moulin, e-RedBook Programme Director of SideKit. Yeah, thank you very much. Thank you very much for being with us this morning and sitting along with us for what happened. This part of the discussion will be led by our colleague, Assembly Member Andrew Boff.
Thank you. First of all, welcome, and I'm very grateful for the little schematic that you passed around, but it doesn't. I don't know if it's actually made it more complicated, right?
That's
to be honest.
view.
And you know, for people who are viewing this meeting, of course they can't see this as schematic, but it does aim to aims to show about the sources of information and what happens to various pieces of information related to early years, children's health. Can perhaps it might be a good idea, Mr. Gibson, if you could give us an overview of the Child Digital Health Programme, what it is and why it's needed.
Yes. So what it is, quite basically, is a way to fix the challenges that we all face as providers of healthcare to children and families. As a midwife, as a practitioner, but also as a technical system supplier. We've known for many years that it's a complex system out there. Every child has at least 133 data points collected on them for the Healthy Child programme, and in London we have 140,000 live births every year. It's a lot of information. And so 4 years ago, NHS England London region went on a journey with our system supplier colleagues as a working partnership to show how collaboratively we could bring solutions to the range of data. So we've been working for 4 years with local authorities, colleagues, directors of public health, consultants, health visiting services, and 2.5 years ago we began commissioning something that is unique in England, if not Europe. What we now have is, rather than small departments in small organisations collecting, collating and analysing this important data, we now have 4 hubs. We have hubs that are strategically placed around children and the new way, the new collaborative way that Devolution London will be acting, called strategic networks. So these hubs model the maternity systems, they model the early years processes. So we have these 4 hubs, and they function off a single platform in London now. What we've done is we've built an engine that takes daily all the information from the map that you can see here, from the 19 maternity providers, the 1,407 GP practices, the range of health visiting services, and churns it. Because the one thing we know about data is you can shift it very quickly if you have the software, if you have the technology, and if you can make it work to be child-centric, it can work very easily. You know, as we say, we've landed men on the moon before now and brought them back again. Sharing data is not the issue technically. What the issue was data sharing agreements between the range of providers. So our 1,407 GP practices, our 19 directors of midwifery, our screening providers, they've all signed a data sharing agreement that says they will send these 133 data streams into our hubs on a daily basis, and every child will then have a single point of truth on the platform in London. So every child accessing NHS services, with regards to the previous, every month we do know where they live. Not only do we know where they live,
good news.
not only do we know where they live, we actually know who the responsible health visitor is. We know who their registered GP is. We know their immunisation record. We know their screening record. And we know if they have a looked after child flag as well now. So since April, since we've commissioned the platform and launched the hubs, since April, we now know all of these, what we call the big data, vital facts information. You know, there are 52.5 million bits of data on London children sitting on the platform. It is a wealth of intelligence that could be tapped into very quickly. You know,
Can I just ask, are these 4 physical hubs?
They are, yes. They're located
where?
They're located in the quadrants of London. So northwest London is situated just north of Harrow. Northeast is situated in North East London Foundation Trust. Southeast is situated just outside Greenwich. And southwest is situated in Royal Borough of Kingston. So they are accredited to NHS Commissioner Data Protection accreditation levels.
Why
so
4? Why not 1?
Well,
why not 6?
We had 23 very isolated hubs who didn't share anything. We thought going 1 was a bit step change too far. And when we horizon gazed last year, 18 months ago, it was very clear that sustainability and transformation footprints were where the levers rested. And it would
and
not...
that was probably the geography of those.
Yes, we began looking at what the future geography is around early years, and it's definitely bigger than Borough, but not as big as London. So if you look at natural population flows, which the platform does, we think we've got it right, but, you know, we can flex. We've got 1 platform for London. It's just the volume of work means we've got 4 hubs.
So are all trusts using this now? Or?
Right, so all maternity trusts are. I think it is important to recognise that every early year strategy must begin with a pregnancy. It must begin, and no child has ever been birthed without a pregnant woman. You know, I think we've got to begin perinatally, antenatally. And so for the first time we have a record of all pregnancy notifications, and that's unique. We're the only region in England to have that. And that's important for early intervention, getting the woman, the pregnant woman, used to early year strategies. And
so this is the antenatal MATB1?
Yeah, the MATB1, the maternity notification, comes in on a daily basis. I mean, obviously important in that MATB1 form, if anyone's in the panel been pregnant, is there is a notification of whether the mother is Hep B positive and HIV positive, because that signals a special flag to the system that this child will need particular attention when born, so enhanced services. So that comes in, 140,000 of them a year. Obviously there's peaks in September and peaks in March, but there always has been. And then when the child is born, the maternity services, if you go to the left of that line, new birth registrations with NHS number and maternal link. So every baby born in England and in London, but in England, has a maternal link made at that time. Now, what we'll find is that maternal link is then used for the e-RedBook, which we're going to explore with you as part of the Londoners' benefits to all of this. So that link made by the midwives, every time a baby is born, the mother is linked to that baby, is a very valuable point in time for a fail-safe, because within 6 weeks comes many points of fail-safe for blood spot. Every child is monitored for 9 diseases. We have up to 12 vaccinations in the baby's first year. We have newborn hearing. We have the new infant physical examination. All of those data points feed in to this hub, and practitioners can see it. So for the first time, there's a platform that allows health visitors or a GP to be able to look into a single unified point of truth on any child born in London or moving into London. We deal with movers in as well. The advantage to that is we can react very quickly. Within 48 hours of the Grenfell disaster, this platform was able to produce a definitive list of every child under 6 who had a postcode out of the 2 postcodes used for the Grenfell Tower. So we were able to categorically state within 48 hours of the request which children had lived in or were living in the Grenfell Tower and accessing NHS services. So we were able to hand that to NHS providers and say, these are the children that you should be looking for as part of supporting the parents or checking and chasing to see if they're well and elsewhere.
So all maternity trusts
yes.
have signed up, and what about other trusts as well?
Well, the important ones for us at the moment is the maternity trust for delivery, the screening trust, so the people that do blood spots, the people that do newborn hearing, and the people that do the new infant physical examination and the GP 6-week surveillance check. Those are the urgent criteria at the moment. What we're thinking about in the future is we can connect something in called Badgernet. Badgernet is the national system for neonatal intensive care units. So we can link that into this hub so we can actually get any neonatal intensive care unit linked in to this record. Because all you're doing is connecting data points using secure technology. And, you know...
So when the GP is doing the 6-week check...
Yes.
The system will pick it up automatically?
It can. It hasn't done yet. It picks up the breastfeeding status, which is critical. But part of the challenge, as we know, is that GPs are moving to a GP version of the new infant physical examination. So we want to wait until that happens, and then we'll absorb the data from general practice and put it into the platform.
So how are you picking up the immunisation status then?
Right. So the immunisations are on the right-hand side. There's 12 of them. They're picked up by a monthly feed from every practice in London. All 1,407 practices send us an electronic feed of every vaccine given to every child under 19, and that is loaded on and attached onto the child's NHS number. It's a technology that's been around for 4 or 5 years, and all we're doing is optimising it.
So you're able to take the information from the GP, from the system, from the GP's computer systems?
Yes, we've taken information from GP computer systems for 8 years.
And they didn't even know about it?
Yes, they knew. They've all signed it. And it's interesting that it shows that a far greater number of children are actually vaccinated than actually reported.
Okay.
So we've done that for 8 years. This is unique because it's also attached onto the screening data before it's fed into the e-RedBook. So
can I ask a question?
Yes.
This is fascinating. I'm thrilled about this. If a child comes in from abroad,
yes.
You're coming to that, are you?
No, ask a question.
If a child comes in from abroad, can they be picked up just as easily? So they won't have gone through the maternity bit, obviously. But they get added too?
They do. This is one of the supports that we're looking for from the Health Assembly, is that we would want anyone moving in to probably the fourth priority for any child moving into London, apart from housing and employment, etc., would be registering with a GP. And the minute a child registers with a GP, they pop up on something called the NHS Spine, and then they could be loaded onto the platform. Obviously, if a moving in family is so busy that they can't register with a GP for a few weeks or a few months, then, you know, the system is not osmotic. You know, it doesn't absorb, it doesn't check and sort. But yeah, as soon as a child, a movement in, comes into London or visits a health visitor, a children's centre or a GP, and it's usually a GP for children, there's a flag put on the spine the next morning. This is a new child to London, and they're immediately absorbed by the platform. And the platform go checking to see whether the child has an NHS number and their vaccination regime.
And what happens when the child leaves London, say moves out of London, the other way around?
A removal, we call that. So yes, when a child is removed from London to either part of England or the rest of the UK, they're flagged as a removal on the spine. Now, the challenge there is they're not a mover in until they register with their new GP. So if we don't know quite which GP they're going to land in, they're just held in a pending queue. But there's still a record of them, you know, and we still know they're a removal out. So at the moment, using the hub, we can say that about 23% of children in London are movers in, less removals out, so there's a demographic growth, and 30.1% of children are in 2 boroughs in their first 6 months of life. 30.1%.
That's high.
Last year, it was 23.7 in their first year of life. This year, by looking at the unified report, 30.1%. By scrutinising 500,000 children in London, 30.1% of babies under 6 months will either be at 2 health visiting services, 2 children's centres, 2 GPs, 2 boroughs, 2 CCGs. So having a borough-based service is no use these days in London. We've got to have a pan-London approach to this. So 30.1 is a big churn, or a big mobility. And but we've got the solution to allow them to get their results, and as you'll discover, it is the e-RedBook.
And I suppose the system also allows you to pick up things like pregnancy, we don't end up in a live birth or...
So yes, I mean, not every pregnancy goes to term. We do pick up miscarriages now. We have a list of miscarriages, and that is recorded on the platform that the pregnant woman has miscarried. So there's no congratulatory visit, and that's now secure. And obviously, some children are stillborn, and a flag is put on the system as well. In London, we have 2,000 independent midwife births every year we didn't know about. So independent midwifery services are new in Waltham Forest, but you know, 2,000 babies are born with an independent midwife that no one knew about. We've given them NHS.net accounts as midwives, and they're now logged on the platform. And last year we had 180 free births, at which there was no NHS practitioner, no GP, no midwife. So we had 180 women giving birth to babies healthily. Naturally. Well, God. Most childbirth is natural, but yeah, there's no...
That's what, only a man could
that's
say
what I'm
that.
trying to make.
Only a male midwife. Only a male midwife. But yes, we also know about the 180 independent, no practitioner present. They're called free births. We never knew that before, because no one knew independent midwifery or no one knew free births. So it's been
horrified.
To me, yes.
It's been a really useful view into the scale and scope and just the intelligence you get when you bring data together and analyse it for London. It's really quite humbling what we have in London.
It's impressive the fact that you've got this data together now,
Yes.
and it looks as though it's in a fairly advanced state of preparedness for taking on the burdens. But who can, perhaps Mr. Moulin can help us out with which agencies can access the children's health data through the hub, the what's it called, the e-RedBook?
Yes, I'll let Daniel talk about the e-RedBook is not the platform.
Yeah.
Okay, it's one data feed with a special wrapper on it. So the platform.
So the platform is the data. The e-RedBook is the method of accessing it.
Yes. For parents.
It's a parental record. It's a personal health record. So it's a copy of the data that sits within the platform.
Yes.
So that's not. So that would just be for parents or other agencies as well.
It is just for parents. Well, it's quite interesting. So it's modelled on the paper RedBook, which is given to all parents nationally at the moment. And it's been in the system for 20 years.
Yeah.
Or over 20 years now. And it started up as a local up initiative, and it's used across services as a shared record at the moment. And what we've been doing is trying to model how the paper RedBook works in terms of governance. And how it can move around the system as an untethered personal health record. So it isn't physically as a paper record, it's not physically attached to any specific service. Parents can take it to any visit or any service they go to with it, and any health professional can go and write into to that record. For a world we're moving to and aligning with the National Digital Child Health Strategy, it's a fairly new world where we've realised that we can personalise much better to what parents need by making interfaces specifically for parents and making interfaces specifically for health professionals. So in London we've been focusing very much on health visiting services, and we've started over the last 6 months focusing much more on midwifery services.
And
so to respond to your question, midwives, health visitors and a few GPs can access the e-RedBook with the parent's permission.
Right. So the parent has to give that permission in order for those agencies to do it.
It's their RedBook.
And that's available now to them?
Yes.
And the any other agencies in the pipeline?
We've got looked after nurses, our children looked after teams. They are beginning to get access to complement the British Association of Adoption and Fostering template, the BAF. So we've offered it to looked after children teams. We're about to offer it to the CDOPs, the Child Death Overview Panel officers. We feel it's so secure and so robust now, and it's proved it's worth collecting and collating and analysing, that we're looking with the CDOP officers in every borough to see whether it can become a CDOP platform to support child death overview. So we're looking as well to see whether it can support not the parents of infants, which it's currently designed to do extraordinarily well, because remember the paper RedBook is a very trusted document. Many parents have it in their memory chest for children, and some of us will even have ours as we go to university, etc. But do we use it for school-aged children, for asthma app? You know, it's not within the wit of technology experts such as Daniel to create an asthma app to empower 5-year-olds, 7-year-olds and older children to have their asthma on it, their diabetes, their screening of those long-term conditions. So yes, we're looking to explore with the parents and children alike and teenagers what it is they want from a digital record, health record.
And we've also seen interest from school nursing as well, which is another important bridge for the RedBook.
Yeah. What's the how is, of course, the big thing whenever we talk about data is how is it kept secure?
Good question. So we obviously make it as secure as we can do, and I think the biggest challenges that you've seen most recently in the press regarding NHS data have generally been down to software not being kept up to date. So e-RedBook is a cloud-based service, and we're permanently working on security threat modelling and analysing risks and putting in risk mitigations. to keep it as current and up to date as we can do?
As Commissioner, it's my job to assure the panel as well that there is a compliance target called the Outcome-Based Specification, OBS, and any provider, whether it's the hub, the platform, or indeed e-RedBook for parents, they are all duly compliant as part of our contracting with them. So the NHS Information Governance Commissioner is kept up to speed about that. So Microsoft Vault, if anyone's technical, Microsoft Vault is the product, yes, yeah. Health Vault, accredited, and it's a very similar process for the platform.
So we've got secure data.
Yeah.
You're saying it's parents are in control of who accesses it. Does that not create a problem when you try to use the data to improve the health inequalities of people? I mean, if parents don't want to reveal the data, how can you identify that you've got an issue?
Right. So the 133 data points are controlled by the providers. So GPs control the vaccination data, the heads of midwifery control the newborn screening data and new birth registration data. We send that to our local authority colleagues as aggregated data. Local authorities do not get to see personal identifiable data, but we can give super area. By super area, I mean a ward. By ward, we can notify our colleagues within a few days in local authorities which demographic of children are not vaccinated.
So that's part of that, something that parents understand.
Yes.
That even though they individually their data won't be revealed, it will be revealed in aggregate in a geographical area. That's
correct. And it's all part of the fairness law that we discuss with parents when they join the NHS services at their GP, is the GP data, the early years data and the child health information services will be aggregated for the purposes of population health and outbreak control measures and all the things that we need to do as part of clinical fail-safes.
Are we going to see an improvement, therefore, in the quality of data, public health data?
We are. I mean, we've already seen that in Barnet, for instance, by looking at real-time immunisation data. By real-time, I mean a week old. By seeing real-time immunisation data, we have 18% more vaccinated children than by looking at it 6 months in historic, 18% improvement. We already know that by looking in northwest London that we can see a 22% improvement in the fail-safe of blood spot screening, because it's a collective way to do it. So by real time, it isn't that day. It's about 48 hours old. But by looking at real time data, we generally know now which families, which demographics are unable to feel empowered with their children's screening, are feeling unable to be empowered with their children's vaccinations, so that we can build tactics with them. I mean, for instance, the e-RedBook can send timely reminders. Now, we all know you just need to sit in public transport. The minute this buzzes, we respond to it. And each of those messages cost 0.6 pence. A letter, a one-page letter with a bit of ink on it, colour on it, £1.87, and at least 35%, 40% of letters do not reach the letterbox. They end up on the ground floor of the block of flats that young London families are in, and they're not delivered to the letterbox. So by using smart technology, we've stopped letters. We're going towards digital messaging via RedBook or from general practice.
You'll be reminding the parents when the immunisations are due?
We believe, I mean, immunisations...
that's something which practices are.
That's correct. That's correct. So the e-RedBook can send a timely reminder, but you're absolutely correct. Practices will want to build a relationship with every parent, and they routinely send out messages.
They do, but by text?
By text, yes. So iPlatter texting is 0.7 pence each. So,
but I can see that the benefit of this being great in terms of public health, right?
Yeah.
And demographic data. But for the individual, like, for example, this red book, the manual red book at the moment is seen by the health visitor, they're seen by any contact they have with the midwife, they have any contact with school visitors, school teachers. They all write in it, and they come to me, right, and they say to me, so here's the red book, and I can read all that stuff about the child. But I won't be able to do that anymore for the individual, right, because I need to have access, maybe someone else hasn't got access to it. So are we not losing the wealth of data for the individual patient? You're getting a lot from in terms of population terms. Yes. Are we losing for the individual? Is my question.
I agree with you. I mean, as a midwife, I used to write in my ladies' red books, or the child's red book. People were lucky they could read my handwriting, I have to be honest with you, because it was a bit sort of fast and furious. I think many parents lost this, mislaid this, and it's lost in perpetuity. I think the thing about a digital red book, an e-red book, is that parents are just as ready to open up their smartphone to you in your presence as they would be to take this in their bag or their tablet, or indeed launch it on a clinic. I've seen them open up in children's centres, and it's a focus of conversation. I've seen them open them up in a library as a focus of conversation. There's a pride, if not an awe and wonder, when parents launch their electronic red book, e-red book, and see their children's vaccination record. It really is quite amazing to watch people's relationship with digital tech. Yes,
the eyes light up.
They do.
Yeah. It's worth saying that this is part of what's been quite a long journey. It's very closely aligned to the National Digital Child Health Strategy, which is driving greater information exchange between systems. So we think there's real opportunity to actually bring you as a GP practitioner more data to actually deal with those parents from wider services across the system as time goes on.
Yeah. Of course, GPs are a bit behind the times sometimes. They're still filling in manual records as well, aren't they? So isn't there a degree of duplication going on at the moment?
There's a degree of duplication, but there's also a degree of lost paper in London. And there's a degree of not being able to read handwriting in London. Most GPs print out these days, though. I mean,
I think there's no GP records now. Every GP practice in this country is
thank goodness for GP system of choice funding. But I think there will always be a place for the paper red book. It's a treasured memory. It's an institution. But more and more parents, because they're tech savvy and they're not... they want to move towards their life in a smart technology in their pocket buzzing at them, then there is now an increased demand, and we've been working with that demand. So we've chosen our prototyping sites very carefully to deal with Wi-Fi. So we do not want to impose a burden on parents of 3G credits. So we work in places where free Wi-Fi is the given. So that's another ask of London and the London Assembly, is profiling it, that you can open it. I've opened up a version today. You can launch it where there's free Wi-Fi. You can launch it in libraries. You can launch it in children's centres. As part of that engagement with that family's wider family situation, okay, the focus is on health, but it could be just as well looking at a page about well-being, weaning, for instance, breastfeeding, because it contains all the pages that we heard our colleagues talk about, which, earlier in your first panel, are contained as go-to places, evidence-based material. It's all accredited by the Royal College of Community Paediatricians. So we know there's an evidence base that parents love the Red Book, and all the indicators are from our evaluation is they really like the digital version of it. It's smarter.
Your replies have been very comprehensive, I must say, and I think I'm going to move on to the very last question, unless other members think I think most of our questions have been fully answered. So finally, the last question I've got for you is, of course, the Mayor commits to this in his health inequalities strategy. What support can he usefully offer, rather than saying yes, me too?
I think, I was listening to the question earlier, I think the whole of the Health and Social Care Collective, particularly with Devo London is a very useful point in time, is free Wi-Fi for well-being. You know, Wi-Fi is a powerful determinant in how to empower parents and people in populations. I think we've got to do joint evaluation with the Assembly and ourselves. Our evaluation is very much about on the impact on parents. How do parents build confidence using technology? We need to evaluate the reach, particularly to the underserved populations, the non-digitised populations. We've got to get more consistent and sustainable relationships with GP practices. They play an important part. Libraries. I love every library to have access to a portal that allowed them to see in, because there will be healthcare there will be provision there. Children's centres, you know, Wi-Fi and access to e-RedBook via children's centres. And also some of our sharper end services, the early year services. I'm very mindful that looked after children teams need to know this type of information, and family nurse partnerships. So those types of services, we'd appreciate your support and the Mayor's support at bringing them into the digital age. It's all free. It's all funded by NHS England. You know, all we need is to build the energy, the passion and the transformation out there, and we'll bring people on board. You know, we're really not looking for budgets as such. I mean, it'd be useful to have a business strategy that is beyond 2020 for people like this. But as a commissioner, you know, it's all within the gift of the commission I head up, it's called Section 7A. So it's the passion and the commitment for fairness and parity across London I'd be looking for.
Thank you very much.
Very interesting. Thank you. Really.
Well, thank you very much for your contribution this morning.
Thank you.
And I have to shut up. We have to close this meeting up in 5 minutes. Well, I was about to say shut shop, right? But I think I meant to close the committee, because 1 o'clock this room should be taken over. So can I thank all the guests this morning for the contributions, and finally can I ask the committee to note the report and the subsequent discussions, and to delegate authority to me as chair to agree any output from the discussions.
Yeah? Agreed.
Thank you. Can we please agree the following recommendations: to agree the proposals for the Health Committee work programme and topic for discussion for the remaining meetings of 2017 and 18 Assembly year?
One very quick point, if I can, Chair. So I know we're very close. The Mayor's recently answered a question for me about a report that's recently been written about the disastrous effect that high-potency cannabis is having on young people in London. I do think this is something that we should look at as soon as we can. I believe it's a health emergency. So I'm just really putting that on the record to feed into the meeting.
We'll pick it up again. Thank you. And to agree to use this next meeting of 11th of January 2018 to discuss healthy early years activity in London, and to delegate authority to the chair in consultation with the deputy chair to agree arrangements for any site visits, informal meetings or engagement activities before the committee's next formal meeting. Agreed. And please can the committee note that the next meeting will be taking place on the 28th of November. Well, that is today. I'm not sure what that. Anyway.
11th of January.
Pardon?
11th of January.
On the 11th of January. Thank you.
GLA, Committee Room 5, Sound. GLA, Committee Room 5, Sound.